Welcome to Roadmap to Residency Evidence-Based Application. So in this video, we will be discussing about gastrointestinal and endocrine drugs. We have discussed about each of these classes of drugs in their respective video in their respective modules. You can go and watch that after this. So here we have, which of the following is the most appropriate next step in the management of this patient's diabetes? A 55-year-old man with a history of type 2 diabetes presents to his primary care physician for a routine follow-up visit. He reports adherence to his diabetic diet and exercise regimen, but admits to occasional non-compliance with his medication due to forgetfulness. His current medications include metformin and sitagliptin. On examination, his vital signs are within normal limits, and there are no signs of acute complications of diabetes. Lab tests reveal a hemoglobin A1C level of 8.5%. Which of the following is the most appropriate next step in the management of this patient's diabetes? Increase the dose of metformin, add insulin therapy, add sulfonylurea, switch to GLP-1 receptor agonist, or initiate a SGLT2 inhibitor therapy. So the correct answer is switch to glucagon-like peptide GLP-1 receptor agonist. So type 2 diabetes mellitus is a chronic metabolic disorder. In the clinical scenario described, the patient's HbA1c level is 8.5, which indicates inadequate glycemic control despite the treatment with metformin and sitagliptin. Therefore, the most appropriate next step in the management of this patient diabetes is to intensify the pharmacological therapy. GLP-1 receptor agonists are a class of injectable medications that mimic the effects of endogenous GLP-1, which is a hormone that stimulates the insulin secretion, inhibits the glucagon secretion, and delays the gastric emptying and promotes satiety. GLP-1 receptor agonists are effective in lowering the blood glucose level, reducing the HbA1c. These are recommended as a second line or add-on therapy to metformin when glycemic control is not achieved with metformin alone or in combination with oral antidiabetic drugs. So which of the following is the appropriate next step in the management of these patients' hypothyroidism? A 38-year-old woman presents to her endocrinologist with symptoms of palpitations, heat intolerance, weight loss, and tremors. She reports a history of Graves' disease diagnosed 6 months ago and has been taking methimazole as prescribed. On examination, the patient appears anxious, diaphoretic, and tachycardic with a heart rate of 110 beats per minute. Thyroid examination reveals diffuse goiter without nodules. Lab tests show elevated levels of free thyroxine and suppressed thyroid stimulating hormone. Which of the following is the most appropriate next step in the management of this patient's hyperthyroidism? Increase the dose of methimazole, add radioactive iodine therapy, initiate beta blocker therapy, switch to propylthiouracil, and refer to thyroidectomy. So the correct answer is initiate beta blocker therapy. In this clinical scenario described, the patient presents with symptoms and signs of hyperthyroidism consistent with uncontrolled Graves' disease despite treatment with methimazole. Methimazole is an antithyroid medication that inhibits the thyroid hormone synthesis by blocking the enzyme thyroid peroxidase. However, it may take several weeks to months for methimazole to achieve full therapeutic effect, and some patients may have suboptimal response or relapse of hyperthyroidism despite treatment. Beta blocker therapy is the most appropriate next step in the management of this patient's hyperthyroidism. Beta blockers such as propanolol, atenolol, and metoprolol are commonly used to alleviate the symptoms of hyperthyroidism, including tachycardia, palpitation, tremors, and heat intolerance. Beta blockers antagonize the effects of the excessive thyroid hormone on the cardiovascular system by blocking beta adrenergic receptors, thereby reducing the heart rate, cardiac output, and sympathetic nervous system activity. Which of the following is the most appropriate pharmacological therapy for this patient's GERD symptoms? A 60-year-old man presents to his primary care physician with complaints of frequent heartburn and regurgitation of his stomach contents into his throat, particularly after meals and when lying down. He reports occasional episodes of dysphagia and coughing, especially at night. The patient denies any history of gastrointestinal bleeding, unintentional weight loss, or difficulty swallowing solids. He has a past medical history of GERD and has been taking over-the-counter antacids for symptom relief. On examination, the patient is afebrile with no signs of distress. Which of the following is the most appropriate pharmacological therapy for this patient's GERD symptoms? H2 receptor antagonist, PPI, anticholinergic agent, prokinetic agent, or sucralfate? So yeah, as you all know, the correct answer is PPI, which are the most effective pharmacological therapy for the management of GERD symptoms and complications. PPIs work by irreversibly inhibiting the proton pump in the gastric parietal cells, thereby reducing the acid secretion into the stomach lumen. PPIs provide superior acid suppression compared to H2 receptor antagonists and are effective in promoting healing of esophageal mucosal injury and preventing symptom recurrence. Last one. Which of the following is the most appropriate initial pharmacological therapy for this patient's nausea and vomiting? A 32-year-old woman presents to the emergency department with complaints of severe nausea and vomiting for the past 24 hours. She reports multiple episodes of non-bilious vomiting accompanied by generalized abdominal discomfort. The patient denies any history of recent illness, abdominal surgery, or food poisoning. She denies fever, diarrhea, or urinary symptoms. On examination, the patient appears uncomfortable and mildly dehydrated. Abdominal examination reveals mild diffuse tenderness without guarding or rebound tenderness. Vital signs are within normal limits. Which of the following is the most appropriate initial pharmacological therapy for this patient's nausea and vomiting? Metoclopramide, ondansetron, flucloperazine, promethazine, or dimenhydrinate? So the answer is ondansetron, which is a selective serotonin receptor antagonist that is commonly used as first-line pharmacological therapy for the management of nausea and vomiting in the emergency department. Ondansetron, or the brand name Ondem, works by blocking the serotonin receptors in the GI tract and central nervous system, thereby reducing the sensation of nausea, inhibiting the emetic reflex. Now, we have discussed about these all drugs in the respective modules in the respective videos. You can go and watch that in detail. Thank you for watching. Keep studying.